Health Ombudsman Professor Malegapuru Makgoba has found that the death of COVID-19 patient Shonisani Lethole at the Tembisa hospital was marred by negligence and poor patient care. Makgoba has revealed that Lethole was not fed for 100 hours and 54 minutes for his stay at the hospital. He joins us now to discuss this report further. Good evening, Professor Makgoba. It's a pleasure to have you on the show tonight. You've highlighted serious issues of competency in this report, which you believe if it were upheld, Shonisani could well have not died from, or even died in the way that he did.
Yeah, I'm very convinced about that, had they paid attention early on when he arrived to some of the areas I think they omitted or they seem to have forgotten, I think the likelihood is that the outcome of this patient's life might have been different. Of course, different means that he would have been alive, yeah.
Let's talk about some of these problems around competency. You found that there were issues ranging from not just the nurses who were attending to him, but even the doctors under whose care he was supposed to be.
Yeah, it's not only, I never raised an issue about competency directly, but, it was a combination of many factors, a laissez-faire kind of attitude that you found, a tendency to obfuscate, I think, evidence all the time, almost to misdirect you to where you need to go in order to find information. You had to be chasing people all over town to find simple pieces of information when it should have been available, either in the records or somewhere else where it was accessible. But this proved to be very difficult for both myself and the investigator.
You described it as a laissez-faire attitude, and it's important because part of what we hear from ordinary South Africans who use the public health system is that they are often left with the impression that the health practitioners who they consult with simply do not care. Did you find that was the case in this matter?
Well, I've recorded that actually in my report, that what really surprised me most as a person coming from the profession, I found that the attitude and the processes that we were brought up with in the profession of caring seems to have drastically changed, I think, over the years. And I'm not sure I can ascribe any immediate reasons to it, except that maybe cultures are changing all over the world, I guess.
Part of what you've done in these recommendations is that you've called for an investigation into the executives at Tembisa Hospital. You also want the hospital, the matter of it being a tertiary hospital, to be taken under review. This certainly would cast serious question marks for somebody who wants to go to Tembisa Hospital or who is at Tembisa Hospital currently receiving treatment.
That's true, but that's not the most important thing about Tembisa Hospital. The most important thing for that hospital is to provide quality care at the level that is appropriate. There's no point in trying to pretend that we have a tertiary hospital when we actually maybe have a spaza shop in Tembisa and calling it a hospital. I think we need to be very frank, open, to improve the system so that people can go anywhere and trust that the system will look after them well. They will have good care, they will be dignified, they will be respected, and the quality of care will be appropriate and of high standards.
One of the issues that you raised was around the fact that it was approved as a COVID-19 treatment facility. Now, that process in and of itself would not have taken place independently. We know that, the health department of the province was responsible for some of the identification and was very heavily involved in this process. Were you surprised then that despite the green light from the health department for this hospital to be a COVID-19 special hospital, that the reality on the ground was that it wasn't capacitated to do that at all?
Well, Kathy, I raised all those issues in my report, but more importantly, I had a very close heart-to-heart with the CEO of the hospital. And he informed me that even the people around Tembisa were shocked, I think, when they were classified as a hospital to manage COVID. So I think he himself was worried that they were being asked to do something for which they were not prepared and for which they were not resourced and for which they did not have the skills. But I don't know where I think the battle or the arguments were lost. But certainly, I think Dr. Mokhaladi was quite uncomfortable about this decision to make it a COVID management hospital. But he said, actually, it's recorded in my report, that the then former, I think, MEC for Health, Bandile Masuku, Dr. Bandile Masuku, said to him that, you are next to the airport, OR Tambo Airport. So you are the first port of entry for people when they come into South Africa. And maybe that might have been the big rationale or reason, I think, for designating the hospital in the way they did.
But when we look at Shonisani's story, it of course doesn't paint a very good picture of the kind of care that people were receiving. And, I want to know if there are any conclusions that you then have drawn around what other patients could likely have faced under treatment in those COVID-19 wards by virtue of the systemic challenges that you found at the hospital.
Well, I can only talk about COVID partly because I'm an immunologist and I understand the pathology a little bit better than many other diseases. First of all, I don't think that Tembisa Hospital is a suitable place, I think, to be treating patients with COVID infections. For the following reason, I think its infrastructure is not appropriately designed, I think, for that type of treatment. Its staff, in terms of the healthcare staff, it's very junior and really lacks the experience and the know-how of how to deal with a pandemic of the severity such as COVID. And secondly, they don't even have an intensive care unit that is designated and dedicated to managing a patient who are infected by COVID. So in what capacity or in what criteria do you use, I think, to make such a place a COVID management hospital? So I suspect that the lack of skills, seniority, the lack of experience, the poor infrastructure just makes it a very difficult place, I think, to be treating patients with COVID.
Professor Makgoba, this is difficult to hear because there are families, many like Shonisani's family, who would have and continue to today entrust that hospital with the care of their loved ones. It is an incredible indictment, the fact that that is happening, and yet somebody like yourself, who's the health ombudsman of this country, is saying that this should not even be the case. What is the way forward?
Well, the reason why I'm a health ombud is to investigate and make findings. I don't have to please anybody to make those findings. These findings are guided by the way medicine is practiced all over the world, and I've had lots of experience of that. The way science is evolving to influence the practice of medicine, the way ethics are moving in the world in order to care and provide high quality, and the way I think legislation is moving all over the world. And I think it is on the basis of that my investigations are really in search of the truth, and it's only the truth that guides the findings that I make, unpalatable as they may be. And the reason why they are made is not, I think, to discourage people from going to Tembisa Hospital. It's to actually identify the problems at Tembisa Hospital and say, let's find ways in which to correct them so that we have a system that is of high quality that can be trusted by everybody. The findings, hard as they may be, are meant to encourage a culture of quality that should exist at a hospital such as Tembisa. not to discourage people to mistrust.
A lot also rests on the executives of that institution. In your investigations, you often found that they were giving you misleading information, that they were giving you incorrect information. Does that speak to people who can be entrusted with an organization as big as Tembisa Hospital is?
Well, it speaks to people that you can train to become entrusted. I mean, I think sometimes they were caught in a bind. They didn't know what to do. Sometimes, their skills, as I say, fell short of what they were dealing with. That's why, as I say, I asked each one of them, if you had a patient with COVID who was your relative, would you actually bring them to Tembisa? Most of them, if not all of them that I asked that question, said no, they wouldn't. Because when I asked why, they said, because the severity of the illness and the conditions of the environment at Tembisa don't match. Now, what they were saying is obviously it's a cry for help. Give us resources and provide us with the guidance so that we can try and match the environment and the conditions that we are dealing with. So I regard my investigation as a point of departure that should encourage the leader or the leadership and management of Tembisa to improve on what they have and see that they create a better environment. And I would appeal to the public not to distrust Tembisa Hospital, but to be part of its solution rather than part of its destruction.
Health Ombudsman Professor Malegapuru Makgoba, thanks for your time tonight on News at Prime.